Hi, I am Dr. M.R. Pujari. I am dental surgeon as well as implant specialist at iSmile group of dental clinics, Bengaluru, Karnataka. So, today we will discuss about teeth cleaning. Many patients have little doubts about associated with the teeth cleaning as well as myth associated with the teeth cleaning. Teeth cleaning is the most important procedure which is done at the dental clinic. Teeth cleaning normally keeps your gums and teeth healthier. So, it is always recommended by dentists to get your teeth cleaning from the dentist at least once in a year. Now, there are different recommendations where we recommend the months and years of teeth cleaning, like some people need once in 6 months, some people need once in a year. Those who smoke a lot, those who have a habit of parasala chewing, frequently taking black coffee and other things, they need once in 6 months teeth cleaning. Otherwise, the normal individuals who don't have any kind of habits, they need once in a year teeth cleaning. Teeth cleaning never damage your enamel. Teeth cleaning is basically ultrasonic high pressure water scaler which normally removes the plaque and tartar from your teeth. They never damage your teeth. So, teeth cleaning is always recommended once in 6 months. So, the common myth associated with the teeth cleaning is that they will damage your teeth, they can make your tooth loosen, they can damage the enamel. These are all actually many of the myths. Actual fact is that teeth cleaning, basically an ultrasonic teeth cleaning, it actually makes your gums and teeth healthier. One shade it can make little whiter, but yeah, it is different from the whitening. So, scaling is always a healthier modality. It never damage your enamel. There are little adverse effects you can say after the teeth cleaning, which is sensitivity for few days. It can sustain for 2 to 3 days to maximum a week, which can be managed with the desensitizing paste for 1 week. Then teeth cleaning never whiten your teeth. Teeth whitening is different. Teeth whitening where we use a chemical gels, we have a laser treatment as well, that we can say that it will result in a little more sensitivity compared to this, and that is not normally recommended for every patient. Teeth enamel, normally in case of whitening procedure, enamel gets little affected because of the whitening, but however teeth cleaning is always a safer modality. We all dentists always we recommend patients to brush their teeth twice daily, which is most important thing. Why twice daily brushing is important? Because morning brushness is basically for freshness. The night brushing is basically removes your plaque and tartar that is accumulated in the morning. You had breakfast, you had lunch, you had dinner and snacks. So, the plaque that is accumulated whole day is removed by you are brushing at night. So, twice brushing is always recommended. 3-minute brushing, you can take time, slowly brush, always be gentle on your gums and teeth when you are brushing. Use a soft-bristled brush and brush gently for 3 minutes, twice daily brushing. Now, there are home remedies which are alternate to this. We know that we have been already heard about different modalities. You can use neem sticks if you are easily accessible to the neem sticks. That will help as a home remedy when you are not able to brush at night when you are outside. So, you can use a neem stick. Another alternative will be few drops of lemon. You can squeeze few drops of lemon. You can add a pinch of salt to that, and you can even clean with that when you are not accessible to tooth brushing. But however, tooth brushing is always the best modality when you do it twice daily.